board member of Rare New England. And it is my pleasure to introduce this afternoon Julie Bolduc DeFilippo. Julie is a doctoral student in the PhD program in social work at Simmons University. Her background includes lobbying in both the federal and state levels, policy, grassroots organizing, diversity and inclusion work, and teaching. Her current interests include studying caretaking experiences of children with PKU, that's a metabolic disorder, and other rare diseases. She is currently working with a team of researchers at Simmons on a study looking at pathways for people of color and immigrants in the human service industry. Currently, she's a full-time instructor of social work at Salem State University, where she teaches in the areas of social policy, the history of social welfare systems, human diversity, generalist practice skills and community practice, and human behavior. Julie is the 2014 recipient of the Dean's Award for her academic excellence at Boston College School of Social Work. Welcome. Thanks for joining us.
Thank you so much for having me. I'm excited to be here to talk about caregiver burden and quality of life among caregivers. So first, I want to start with a definition that we can all begin with. And caregiver burden is described as the physical, psychological, or emotional, social, and financial problems that can be experienced by informal caregivers. And informal caregivers are the family and friends who provide critical and ongoing care to people experiencing disability, illness, or end-of-life circumstances. And so on the other hand, we have formal caregivers like the doctors, nurses, and sometimes social workers that provide their services for compensation. And so caregiver burden is a fairly well-researched area. And it's a well-established problem with caregivers to older adults, especially with Alzheimer's disease. We know quite a bit about the effect and the burden that people caring for older adults take on in their lives. A related concept, and I like to think of it as kind of an updated way to talk about caregiver burden, is quality of life. And the World Health Organization defines quality of life as an individual's perception of their position in life in the context of culture and value systems in which they live and in relation to their goals, expectations, standards, and concerns. And so the literature really looks at quality of life across 5 domains. The first is sort of biology, so physical status and functional abilities. Then somebody's psychological status. Their social interactions, economic and work status, and religious or spirituality status. So we don't know a great deal about caregivers to children in general, and especially children with rare diseases. But there is some research that's been done on parents of children with chronic diseases and their quality of life that we can look at. The first is autism spectrum disorder. And these group of studies really look at children that are on the higher end of the spectrum. And they suggest that caregivers do experience a lower quality of life than parents of children with typical intellectual development, because the lifelong caretaking that this disorder causes, and the amount of stress and care management that that people with autism spectrum disorder need. Another study sort of groups all different diseases together and says that parents of children with disease report lower quality of life than parents of children without disease. And then another chronic condition that we know about is type 1 diabetes. And this study looked at parents' life satisfaction and said that it was most impacted by having to constantly explain the condition and the child's needs to others, and the worry that the caretaker had about the child's development and any future complications that the child might develop. So again, there is limited knowledge about caregivers to children and people with rare diseases and their quality of life or caregiver burden. But we do know a little bit about this population in a more common rare disease, PKU. And all of the studies that look at this caregiver population are from Europe. So I would expect, and to my knowledge, there has not been any studies of this population in the United States. So I would expect these studies to look different given that we have a much different healthcare system and different social service system than in Europe. But we do have a glimpse of what caregiving is like for a child with a rare disease like PKU. We know from a study in the UK that parents have to reduce their working hours, and that about a quarter of parents had to leave their jobs altogether to manage their child's needs. So PKU is diagnosed via the newborn screening, which we'll talk about in depth in a second. And this means that diagnosis comes within the first week of the infant's life. And another study found that because of this, health professionals expect parents to understand their child's disease quite quickly and to get on board with treatment almost immediately. And this is a lot of pressure and stress for parents of children with PKU. They often also struggle about and worry about their child fitting in the future and describe the acceptance of the diagnosis as a continuum. Another study that had a quality of life questionnaire showed that parents scored lower on the impacts of emotional well-being. And because PKU, if gone untreated, causes severe brain damage, a lot of parents have worries about their child's school performance. Even with treatment, children with PKU can have a lower IQ than children without PKU. So there's a lot of fear around the child succeeding in learning. And we know about this population that quality of life is lower the younger the child. So it's particularly low among preschool children or younger. So my study looks at caregivers to children with PKU a lot across the lifespan. I wanted to know what their experiences were. And the study had three objectives. The first was to gain an understanding of the types of needs experienced by caregivers to children with PKU, to understand any barriers caregivers face, and to learn more about the services provided to families. And so this was a qualitative study that took a phenomenological approach. It had 8 participants who were the primary caregivers of adult children with PKU. So again, this study really looks at caregiving across the lifespan of a child. And they were all mothers, and they represented all regions of the United States. They derived from 8 states. So just a little information for you about PKU. It is an inborn error of metabolism, and people with PKU are missing the phage gene that converts the amino acid of protein phenylalanine into triazine. And because their body can't make that conversion, phenylalanine builds up in their bloodstream and creates brain damage. So this is a rare disease. It does affect 1 in 10,000 babies in the US each year. And this is about 250 babies born a year with the condition. Estimates currently put the people living with PKU in the US at about 16,500. And this disease also has some medical significance. It was the first genetic disease that could be treated via diet. Prior to PKU, your genes were just considered your destiny. And it was the first disease tested for via newborn screening in Massachusetts in 1962. Now, all infants in the United States are screened for PKU within the first 24 hours to 48 hours of life. So what does treatment look like? People with PKU eat a low phenylalanine diet, which means a very low protein diet, which consists of most vegetables, most fruit, and specially formulated medical food for which you need a prescription from a doctor. And there are about 2 to 3 medical food manufacturers in the United States. They also must consume a medical formula daily. And this medical formula has the other 19 amino acids of protein that the person can have and excludes phenylalanine. There also is at-home blood monitoring, and for an infant, it's about weekly, all the way up to an adult with stable Phe levels is about monthly. And this happens at home. It's a finger prick onto a special piece of paper that is sent into a PKU monitoring program. And then lastly, people with PKU must have regular clinic visits, especially the younger they are. And this consists of a meeting with a geneticist, a dietitian, and sometimes a social worker. And these are not sort of ordinary in hospitals around the country. So some families have to travel a great distance to go to clinic. So 6 themes emerged from this study: diagnosis experience, stages of care, mealtime, insurance challenges, coping strategies, and positive outcomes of caregiving. So all participants had children that were diagnosed from the newborn screening process, which isn't surprising since that started in the 1960s, and their children were diagnosed in the 70s and 80s. So this is, again, one of the conditions that is screened for at about 24 hours to 48 hours of life, along with 35 other conditions recommended by the Health Resources and Services Administration's recommended uniform screening panel. Now, that doesn't mean it's mandatory. It's not mandated by the federal government. It is left up to the states to adopt the recommended uniform screening panel. And something that stood out about this study is that 4 out of 8 of the participants had a similar story of being told by a pediatrician that the result of the newborn screening was likely a false positive. And this really made the experience so much harder for them when the result was actually confirmed when they got to the PKU clinic. And this quote from Linda really represents what these families went through. He said, "You're on my list to call. One of John's tests came back high and we need to repeat it." I said, "Okay, is this something I need to worry about?" He said, "Nah, no one has it. Don't worry about it." Then he called me the same afternoon at home and said, "I made an appointment with you at a geneticist for tomorrow morning at 10 to repeat the test." And I said, "Oh, that sounds more dire. Are you sure everything's okay?" And he said, "Yeah, don't worry about it. No one has it. No one ever has it." So this really represents this false positive that these families were sort of held out there and gave them a lot of hope and sort of to protect their feelings, but they describe it as making the process much more difficult and much more traumatic when it was confirmed that their child had PKU. Some of the words to describe this experience were hell, traumatic, hard, and frightening. They talk about crying and breaking down at the news of the confirmation of the result and feeling like for weeks on end that they were just crying. Something also unique around the period of diagnosis is the disruption of the breastfeeding experience, since this is a metabolic disorder. So babies with PKU can be fed breast milk, but it must be monitored, and they have to be supplemented with the PKU formula. So some of these mothers describe that they really had just planned to exclusively breastfeed. So this was quite a surprise for them. And then their infant became somewhat confused once a bottle was introduced and they had to give up breastfeeding altogether. And this was really described as another loss around this period, a loss of bonding and attachment with their infant, and a loss of control as well. There also was a need for more information. So none of these participants had ever heard of PKU prior to the diagnosis. No one in their families had had it, even though it's genetic, it's so rare. And they had never met anybody with it. So there really was a need, and most of them were given maybe one piece of paper and sent home and that was all they had about the disease. The internet wasn't as accessible as it is now. So there really was a need just to know more about what their child's life trajectory would look like. So all of the participants described battling with insurance companies as a daily part of the caregiving experience. There currently is no federal law mandating coverage of medical food and formula. There is a law being proposed, the Medical Nutrition Equity Act, but it has not been passed yet. So this really leaves coverage up to the states. So 36 states have passed laws mandating coverage, but it's really regular for insurance companies to find loopholes around those state laws and refuse to cover medical food and formula. So the experience really varies by state, and that's what showed up in this study as well. And to give you an idea of how much treatment, nutrition treatment can cost, for an infant, it's about $2,500 annually, all the way up to an adult or a pregnant woman is about $25,000 a year. So we really saw how much this burdened families in this study. So in California, they had 100% coverage of formula and 80% coverage of food. In Kansas, there is no state coverage laws. So the caregiver had spent about $32,000 on formula over several years, and they had no access to medical food because it is very expensive. So they made all of the food themselves. Massachusetts has a state law mandating coverage, but so many health insurance companies were getting around it that the Department of Public Health got really tired of fighting with them. And so they established the Massachusetts PKU Fund, which covers formula and gives families $5,000 a year for food, which is really great. But prior to that law, the participant had spent about $12,000 on formula alone. And then in Texas, the caregiver's adult son was sent a letter by Medicaid saying that formula was covered 1 month, only to receive another letter the next month saying that formula was no longer covered. And she had to come up with $2,500 in 1 month, which was a huge strain for her family in order to get her adult son access to medical formula. So this and the other, it's not just medical food and formula coverage of things like dietitian visits is something that they always battle with insurance companies about. So this this fight with health insurance companies is quite stressful. The financial strain is quite stressful on caregivers, and they just spend a part of their life daily in battling with health insurance companies. All of these caregivers were incredibly resilient and had developed several coping strategies to deal with their child's needs. One was faith. So they talked about how their faith really gave meaning to the fact that their child had to live with a special need, and helped them with the stress of caregiving and gave it some meaning. Social support was so important, and I'm going to talk about that next on the next slide. But they had all participants had partaken in something like a camp for kids with special needs. The National PKU Alliance holds a biannual conference, which unfortunately was canceled this year due to the pandemic. There are about 11 to 12 regional family groups for people with PKU, and those hold events and get-togethers, which were also really helpful. And just meeting other families impacted by rare disease or PKU really helped families. And then, of course, any extended family or friends who could help the caretaker also were really helpful. Acceptance was something that was also described as a coping strategy. So the caregivers that tended to be more on the positive end of acceptance that their child would live with a special need and that they would have to have a lot of care management responsibilities just dealt with what it was and felt like they were able to perform the task more easily than when they didn't have acceptance. And then talking to others about what it's like caring for a child with PKU and the care management responsibilities was really helpful. And people talked to just friends, family, and therapists and found that experience to really aid them in their care management experience. So, social support is a key component to addressing caregiver burden. And one of the studies on PKU shows this as well. And so research findings show that caregivers might not have people within their existing networks, in-person networks, who share the same caregiving experience. So digital tools become vital to enabling these new connections. And so I think groups like Rare New England and this conference is really important. And unfortunately, a lot of the social support activities that we've had, that the rare disease community and the PKU community typically have access to, have been canceled because of the pandemic. So social media has become even more important. And that's something that these caregivers didn't have early on in their care management experience, but really benefited from connecting with people around the world about caregiving and about their child's disease. And so I think really leaning on social media and having conferences, if we can even do them online, are really important. So a finding from this study is that caregiving for this particular group is lifelong. So all the caregivers had children in about middle adulthood, and they were still involved in their care in some regard. And caregiving really happens across 3 stages. In early childhood and middle childhood, the caregivers describe it as all consuming. Their styles were described as specific, neurotic, and all out. And they talk about how the infant is completely dependent on the caregiver while their brain is growing about 90% at a rapid rate. So they feel like they can't get it wrong in any regard. One caregiver described wiping, when her child had started solids, wiping the child down and wringing out the washcloth on the medical scale to make the feed calculation. Another described her child vomiting and panicking because she didn't know how to make the feed calculation. So this is a very demanding time for caregivers. Adolescence isn't really unlike adolescence for children without disease. So these kids are starting to become independent. They're starting to experiment a little bit more. And so the caregivers said there was somewhat of a loss of control, feeling like you had to give your child a little freedom. And if they made mistakes, being there to pick up the pieces. And then the adult years, again, they were all still involved, whether it be financially supporting their child for food and formula, to supporting them with cooking still. And we know that as people with PKU get older, they become less compliant with the PKU diet. So about 50% of adults are out of compliance with the PKU diet, which results in things like a lower IQ, epilepsy, anxiety, and depression. They really describe worrying for their adult child's health a lot, and that really consuming a lot of their emotions. So mealtime isn't an ordinary time for these families. It's very stressful and strategic. Every meal needs to be meticulously planned and then monitored for fee levels. And they really talk about 2 styles of managing this. The first was that the family partook in a meal inclusive of the PKU child. So all of the sides sort of matched. And then the non PKU family members had maybe a protein item. And the other was 2 separate meals. So the PKU family members had their own meal, and the non PKU family members had a separate meal. And these parents felt like it was important for their child to learn that they didn't eat mainstream food. Um, and all of the caregivers had adults in various forms of compliancy with the PKU diet. So I can't say that one is more beneficial over the other. It just really seemed what suited the caregivers best. And so a finding from this study that really surprised me was that these caregivers were really shaped in profound ways from caring for a child with a rare disease. And there was a lot of positive outcomes of caretaking. The first was cooking. They had become astute chefs that were really comfortable with cooking just about anything and experimenting with foods because they had to cook so many special foods for their PKU child. They also felt like their family ate more fruits and vegetables and had a healthier diet because of PKU. They also describe having a lot of empathy for other people that live with difference or that are marginalized. So they talk about having sort of a deep awareness and empathy for people who struggle with things like disabilities and people who might be marginalized in society, partly from the experience they have, the socially unjust experience they have with health insurance companies. And then all of these women were incredible advocates because of their experience. One had started a nonprofit, another had founded a medical food company. A lot of them had advocated for state coverage laws. One wrote a book, a children's book about living with difference. They've spoken about the importance of newborn screenings at places like March and Dimes events, and many had been integral in the founding of those family support groups I mentioned earlier. So, what does this mean for the rare disease community? Well, we know from PKU studies and from this study in particular that PKU caregivers definitely have a lower quality of life. And so we can deduce that maybe caregivers to children and adults with rare disease also have a lower quality of life. I think social support is really important and key to coping with caregiver burden and stress, and is something that we should go on to create as many opportunities as possible for people in the rare disease community to come together and support one another. And then lastly, we just need more research on this experience. So further research on caregivers to children and people with rare diseases in general is needed and something I'm really committed to doing. And so I'll take any questions.
Thank you so much, Julie. That was a terrific review. Have you ever heard or did it come up in your research the concept, the bonding that can occur between parents or caregivers and the person who gives the diagnosis? In other words, parents might talk about the worst day of my life is when I found out the diagnosis, but they have an incredibly strong and like an intimate bond with that caregiver, with that provider who started the journey with them and continued with them.
That definitely was described. People described their care team as being like part of their family. And a lot of them had been followed by the same clinicians since diagnosis. So they definitely felt bonded to them because of that. But yeah, there really was close bonds with the care team.
Okay, and I welcome questions to pose to Julie. The other thing is, in your research, were any patients or did caregivers talk about their child being treated with pegvaliase as a treatment for PKU?
So none of them had tried. It was called PegPal for a while. Now it's called Palynziq.
Yeah, right.
None of them had actually gotten access to it yet. But one had said like her son was really hopeful to get on that and felt like he was being he looked at it as sort of a cure, and so was being less compliant, which he didn't like. But it definitely is out there. It is an option, but these people did not have access to it yet.
No, so what's interesting is that, diet therapy can be for PKU anyway, but for other disorders where diet is really manipulated in a very challenging way, intrusive way, is the diet is so complex, is so intrusive it is really not sustainable. The parents, it becomes their parents, the caregiver's lives as you describe it. But when the patient takes it on, they really can't sustain it for very long. And so in the medical community, it's sort of regarded as a Band-Aid therapy. It's not something, we need to find better therapies. What Peg Palynziq provides is a very, very strong, simplified treatment, which allows patients to completely normalize their diet if it works. So it might be useful to compare the population that you described with a population who are now on this. You might be able to discern then, because a lot of the diet issues melt away and the complexities that go with it, compare where the anxieties and issues came from for caregivers that related to the diet, which is now gone and is now replaced by a much more focused therapy.
Yeah, I definitely am interested in that. And I think the biomed world is just exploding right now for PKU. They're really trying to find a cure through CRISPR gene editing for this disease, just because the research has shown that the diet is not feasible for adults to stay on.
A couple of questions. I understand that your participants were all mothers who were the primary caregivers, but I was wondering if you got any insights into other family members who are not the primary caregivers regarding their.
So that's a really interesting question, and something I wondered a lot about, like, what is the role of the fathers? Some of them did, they talked about like they were the primary ones managing this, but that their partners were supportive and were involved. I have a child with PKU, and my husband we're equal partners in this, and he's involved just as much in the care management. So I think going on, I would like to do a study on fathers' experiences and see how different it would be with mothers.
Mhm. And then one other comment. Do you think that the strong bond that we talked about before is related to the length of the search for diagnosis? Might it be due to the fact that they were treated poorly with other doctors before they got to a diagnosis?
So I think PKU is unique in that it's diagnosed from the newborn screening. So there isn't a long diagnosis experience. It's really within the first week of the infant's life. But I think when they get into the PKU clinic and have those specialists, that they become bonded with that. I think we should think more about the fact that pediatricians are sort of giving these families some false hope because they don't want to deliver bad news, and what that does to these families. That was a significant finding, that 50% of them were told, don't really worry about this, it's not a big deal. And they had that attitude, went into clinic, and were just utterly shocked when the result was confirmed.
Yeah, that makes sense. Last question. Have you looked at the impact on quality of life results of finding connections with other caregivers, that is outside the family? Are there any data on the power of community?
So in terms of social support, there's a lot of research on older adults and sort of caregiver burden and the role social support plays for caregivers. And so connecting with community is part of it, like having connections with people within the community that can be helpful to the caregiver, emotionally, physically, in the burden of caregiving. But not for, there isn't, this sort of research really focuses on older adults. So it's hard to find sort of specific populations within that, but we do know that having connections to community is really important to alleviate caregiver burden.
Thanks, Julie. All right, so this closes our session for today. Just a reminder to all attendees that this presentation will be recorded, it is recorded, and will be on the RNE website. So thanks again for attending. Bye-bye.